All right, so welcome back there, guys. That is a good overview and a good video. Really explains at a high level Pacific College and kind of really just general information from there. But let's dive into some of the details. Again, one last time, it looks like we got everybody here. All questions and answers will be had at the end of today's session. Those who jumped in late, again, my name is Mike Santoro, Director of Admissions for the New York campus, and we're happy to have you here today. We're going to go quick, get you all the information you need, and just have some back and forth, some organic questions and answers. All right. So Pacific College has been around for quite some time. We actually started in 1986 in San Diego, California. We have 3 campuses now across the country, being San Diego, Chicago, and New York. This particular program we're talking about today is 100% online, but we started with acupuncture and traditional Eastern Asian medicine, then offering both massage therapy, both Eastern and Western modalities, and have really grown and really primarily become a holistic nursing program, offering an RN-to-BSN program for completion with a holistic nursing foundation, not even a post-bachelorette. You can now start with the associate's degree. We just recently changed that for holistic and certification in holistic nursing. We have a Master of Science in Nursing. We have a medical cannabis certification. And even now, starting this January, we'll have our first pre-licensure program to be able to sit for the NCLEX, and it's a BSN in holistic nursing. Today, specifically, we're looking to talk about the RN to BSN completion program and the holistic nursing certification. All right, and so really within the umbrella of our nursing programs here at Pacific College, this is kind of our vision or our mission statement, right? I like to call them the 4 pillars. That is education, coaching, leadership, and research, right? We want you guys to learn. We want you to spread the knowledge, become leaders and pioneers in this space, and continue to grow by doing your own research as you step foot into the holistic nursing world, all right? And just really influence the change. And what we are seeing is the evolution of the healthcare system and the overall well-being of the people that you're working with, right? And we'll get into some of that detail in just a little bit. But we mentioned it in the video here, but here's some of the, the way we view what holistic approaching is to nursing, right? You guys heard it. It's just getting everybody involved in the process, right? The patients, the clients, the families, really getting those in the healing process, more so even preventative healing, the self-care practice they need for a better lifestyle, really putting the focus on what that individual needs, right? And guiding those involved through the process, how to manage the stress, maintaining a healthy lifestyle, again, that preventative disease and improving the overall well-being of the people that you're working with. Work with everybody in the process, work on integrated health teams. That is becoming more and more common. But really what it comes down to, and really a big part of our program, is self-care, right? And self-reflection into your own day-to-day, right? This is a major piece of our program, all right? Self-care, in that you are a selfless individual. You have dedicated your career to helping other people, right? But it's important that you take the time to take care of yourself, because if you don't take care of yourself, you can't take care of other people, right? And so self-care and self-reflection is a big part of the program here at Pacific College. And so the program is built for a working nurse, right? Those are hectic. It's a hectic lifestyle. It's a hectic career. You're working 12-hour shifts, 5 on, 5 off. Sometimes, very minimal than 5 days off. So the program is built for working adults. It's run on a weekly basis, all right? Very high touch, very much so involved. Basically, the classes meet on a weekly basis. We're a trimester program. So the classes will meet weekly for roughly 14 weeks. Within those weeks, you will have due dates, right? Maybe Tuesdays and Thursdays and Sundays, maybe an assignment due or a small paper. Occasionally, we will have a live session. We'll provide those dates to you up front. It is not required in any means for you to attend, although we highly encourage that you do. This way you can participate in that. Worst case, you cannot attend. You will have to watch a recording and show that you watched the recording through some form of assignment, participation, etc. Right? The classes run for the most part in 7 or I would say 14 to 15 week modalities. Every class is slightly different. For the most part, the majority of them are 14 weeks. Although we're an online program, the feedback from students has been pretty consistent that they have the ability to develop strong relationships with our faculty and our staff. All right. Again, from an accreditation standpoint, we are program institutionally accredited by WASC. WASC is the Western Association of Schools and Colleges. That is the gold standard of accreditation that you can have in the United States, given to us by the United States Department of Education. And then programmatically, the ASIN, right? We're also AHNA endorsed, giving you the ability to sit for the American Holistic Nursing exam. All right. And in 2022, we did receive the AHNA Excellence in Holistic Nursing Education Award for our RN-to-BSN program. All right. So probably no questions yet, and that's okay. We're going to get to them at the end, but we're going to get into the details stuff here in just a minute. All right. So we're teaching you what is in demand right now across hospitals that are speaking this stuff, and just hospitals in general, right, within the holistic world. Transform and start your own individual practice and your kind of view on health. Incorporating and teaching you modalities that are being taught and used nationally, right? Guided meditation, acupressure, ear seed, Reiki, aromatherapy are some of the bigger ones. Again, we're not here to get you licensed. Every state has different requirements for these specifics, but these are the type of the holistic modalities and practices and the benefits that they have on the human body that we will be, teaching you, right? And then overall, the overarching theme of the mind, body, spirit framework, and the, psychoneuroimmunology of, how it works, all of this holistic approaches impacts the human body, like stress and the impact of different types of techniques and modalities, right? So, all right, we're going to get into a lot of the detail here, then get to some of your questions and answers here. Our RN to BSN program, all right? I know it says full-time on there, very, very rare. I would say 99.99% of our nurses are part-time students, all right? They're taking this class 2, maybe 3 classes per term. Sometimes, 2 to 3 classes per term. I would say on average, you're going to take about 2 classes per term. At that rate, it will take you just over 2 years to complete the program. You could do this full-time. It could take you a year, but as a working nurse, right, we're preaching self-care. We're a holistic school. We don't want you to, burn yourself out. All right. As mentioned earlier, it is 100% online. In order to be eligible for this program, you do need to have your RN licensure and at least your ADN in nursing. All right. And that would make you eligible for this program. We'll talk about the steps to apply in just a little bit. But here on the screen here, you will see our core RN to BSN classes, right? So these are all the core classes you will take. All right. You'll see there down there, number 2, we do host a virtual retreat in one of your earlier classes, Nurse as a Facilitator. These are listed in our course catalog with the details if you do want to go into more detail with them. And then everyone's favorite class there at the bottom, I know I just mentioned it, but I call it PNI, it's just easier to say, but psychoneuroimmunology, right? And this is the mind, body, spirit connection between the impacts of these different types of modalities and whatnot that we're going to teach you. It is a fan favorite, undoubtedly, through all the programs, the classes that we offer for both programs that we're presenting here today. All right. As far as what it looks like from a transferability standpoint, all right, this is also connected to cost. All right. The cost of the program and the cost you'll see on the tuition sheet is assuming you do not transfer any credits in, right? We legally have to provide to you the worst case scenario on what would you be coming out of, what you would be paying if you didn't transfer any credits in. However, I've been here for many, many, many years. I've seen hundreds and hundreds and hundreds of evaluations. We do an individualized transfer credit evaluation for every nurse who comes into our program, all right? With that being said, we do transfer up to 90 transfer credits. And with that being said, on average, our nurses are paying around $18,000 to $20,000 to complete our program, right? And that's a difference of 2 to 3 classes, all right? If you came in here and had a perfect transfer and just needed to take the core classes, you're probably paying somewhere around $15,000. However, usually not the case. It is rare that it happens. You'll have to take 2 to 3 additional classes, at which point it's roughly $1,500 per class. Some pay a little bit more than the $20,000, some a little bit less, but it's going to vary. But you're looking around $17,000 to $20,000 to complete your BSN program based on transferability. All right. We do accept financial aid. We do payment plans. In order to receive financial aid, you do need to take 6 credits. That's roughly 2 classes here at Pacific College. We are pay-as-you-go. So if you wanted to pay out of pocket, what we do is we set you up with a payment plan, and ultimately you will pay the cost over four months, right? The length of the term, you'll make monthly installments, and you're only going to pay for the classes that you signed up for. As well as we always suggest tuition reimbursement to ask your hospital if they offer some type of tuition reimbursement to be eligible for the program. All right, so that is our RN-to-BSN program. I want to switch gears over to our holistic nursing certification. All right, you can disregard that it says completion of bachelor's degree. In order to be, you can also get into this program with your ADN. A bachelor's degree is not needed. You can get in here being an RN as well as with your your ADN degree. All right, a little bit different. This is pulling from 4 classes from the RN to BSN. If you're not looking for a BSN, the BSN launched because nurses were interested in holistic medicine, and a bachelor's degree became a norm to be able to practice or maintain their job position. So we created that. If you are looking for something a little bit shorter, still interested in holistic medicine, this is our holistic nursing certification program. All right, it is a 2-term, 8-month program. Again, all things apply. It is online, class modality, all that is exactly the same. It also allows you to sit for the holistic nursing exam. Total cost of this program is $5,886. All right. So again, I'll guide you to the tuition sheet that is attached here in today's webinar that you can download. I can send it to you I'll reach out to you after today's session and let me know if you want a copy of it, as well as the sample curriculum for the RN-to-BSN. And you'll see the overview and curriculum for the nurse certification. All right. Now, same things apply as far as payment goes. I will note, though, however, because of the way the credits roll out, term two of your program, your second term here, you cannot use financial aid. You do have to come out of pocket, take out some type of private loan. Or set up the payment plan, right? Only because you need 6 credits to receive financial aid. So term 1 is 7 credits and term 2 is 5 credits. So it's where it falls short, all right? Now, any questions there, we can get to it, but these are the 4 classes that are offered in the nurse certification program. Again, that virtual retreat, and then that psycho-neuroimmunology class. I didn't mention it for the RN-to-BSN because I wanted to mention it here because both programs do require clinical hours, all right? For the RN-to-BSN program, you will take it during your community health class. For the holistic nursing certification, it is the 2nd class in your term 2, all right? That is your clinical practicum, both 90 hours, and we're gonna get into detail of what that clinical looks like, all right? So we just mentioned that there. We can and we will help you out, all right? Now, I will note that we highly encourage you and recommend to get out into your space, ask around, talk to people. We have found over the years that people are like, yeah, I don't have that in my area. The more you get out, the more you network, the more you talk, the more you're gonna find out, all right? So we're going to encourage you and empower you to look for things on your own, but we can and we will help, all right? So from a preceptor qualification for the clinicals, you're looking for a doctor of osteopathy, a nurse with their MSN, a naturopath, all right? These would be the preceptors for both programs. The community health for the RN-to-BSN program, all right, think community health, right? You're gonna work in a community-based situation, offering the modalities and the techniques that we're teaching you, right? Senior Center, American Heart Association, a homeless shelter, something community-based, right? And that's where you're gonna be doing that. That could be in your local, could be somewhere that you might already be thinking of, that you already have in your mind. Again, if you're like, I live in the middle of nowhere, because we are across the country, we can and we will help you, all right? But you'll be surprised what you can find out there, all right? So when it comes to the clinical practicum for the nurse certification, again, a lot of flexibility here, a little bit different though. You're going to be working with one of these preceptors doing the holistic work in your area, right? You want to work with somebody who's maybe incorporating traditional medicine, but interested in the holistic space and just partnering with them. Somebody on the bend of holistic medicine, maybe one of your colleagues or peers has opened up a wellness center and you're working in that sense. So a lot of flexibility of what you can do there. And again, we can and we will help you. Prior to about a term ahead of time before your clinical, you will connect with and have meetings with Sandra Riviera. She is our clinical director here at Pacific College, and she will work with you, go into a lot more detail here with all this stuff. But again, we're encouraging you to get out there, kind of get your mind going now. Maybe you have envisioned a place where you can work. And yeah, perfect, good. All right, so to wrap this up and get into kind of the admissions process, how does Pacific College view a holistic nurse? You know each person is a unique being. You're looking to get involved and partner with the healing process. You understand the mind, body, spirit. You're looking to continue to grow as an individual. Again, that value and the importance of self-care, self-reflection, and continued ongoing growth for yourself as an individual is something that is important to us as well here at Pacific College. All right. So what does it look like to apply? Well, we are now currently enrolling for our January term. All right. I know it seems close. It is an easy process. We do still have spots available. We're on a trimester-based system, right? So our January term will take us through mid-April. Then we'll get started back up in May for what's considered our spring term. Spring will run through the summer, about mid-August. And then we'll kick back off in September. September takes you all the way around back to the holidays, and then up and running for January we go, right? So if you're starting this January in the nurse certification program, right? If you started January 8th, that's our first week of classes. January 8th would take you to April. You would be done by August of this year for the certification. All right. So the process to apply, right now we're only taking applications for the January term. We will start taking applicants for May, early January, just because of demand. But you'll either want to make sure you connect with an admissions representative. This works fine well if you feel like you have all your questions answered. You'll want to apply directly on our website. That is a $50 application fee, 50. From there, you will want to send over, once you've applied, the documents we need, right? For the RN-to-BSN program, we need copies of all of your undergraduate transcripts, specifically your nursing program. We have found that a lot of students have transferred into a nursing program, so we need the school you transferred from as well. So all those transcripts, do that evaluation, save you cost, time, and then a 1 to 2 page essay as to why you're looking to join the program. All right, the nurse certification, we also need your transcripts as well, on top of a 2 to 3 sentences as to why you want to join the program. All right, we do no longer do phone entrance interviews just because of the high demand here. Once your file is completed and we have everything we need, your file is sent over for acceptance. It is reviewed, and you will receive a letter of acceptance, and we will register you right for classes. All right, so giving us about 3 weeks. Transcript wise, everything is electronic these days. They come over almost instantly to within 24 hours. If you have unofficials, we can take those as well for now, but you will need the official copies to complete your file. But that is a crash course on our nurse cert and admissions program here at Pacific College. You can see some of the common questions here that we can get to, but I do want to answer your questions first, right? So I throw it out to you guys. What questions do you have? And what can I help you out today? And while you find the questions section, there's a questions section here located. I'm going to put my information so you can shoot me an email, and I will answer that question because it's going to come up, right? We get this a lot, right? Where can I work as a holistic nurse, right? And I want to take you guys through the crash course of my time here at Pacific College and what we've seen from nurses. So I mentioned it earlier. We launched our RN-to-BSN program back in 2013 with the demand or the need for nurses needing their BSN in order to maintain their jobs or to even entry level into the career. With that, we saw interest in, obviously, people interested in the holistic space, but more so nurses who had their BSN that wanted to sit for the holistic nursing exam. So we launched the nurse certification. All right. As we progressed, These students were just, it was a personal interest of their own to just study holistic medicine and put it to work in their practice, right? As time went on, hospitals started to open up integrative divisions, right? And we started to help those nurses out. They became lead head nurses in these integrative holistic divisions. They were still personally interested in holistic medicine and then sharing their knowledge with others, all right? Then came the pandemic. Pandemic really changed everything drastically for nurses, as you guys probably know. And nurses are starting to pull away from traditional medicine, right? They're tired, they're burnt out, they're overworked. The traditional system has been exposed, right? They don't want to be pill pushers anymore. They want to treat individuals and for what the individuals want. And so what we are seeing now is our nurses are coming to our program to become trained in holistic nursing and starting their own wellness centers, right? They're starting their own thing where they incorporate holistic practices, preventative health in their own space, right? And that is currently where we're at in the world of nursing within, from our perspective, right? That is exactly what we're seeing our nurses do in this time and place. So I pose it to you guys, is there any other questions that I can answer for you here and how I can help you out, right? Let me know what questions you have. Any questions at all? Okay, well, I must have done an amazing job. I've done these several times, so I try to hit the key points that are out there. I'm going to hang back. Sometimes it takes a minute to find the question section. But I do want to thank you all for your time today. I want to get you back to your busy, hectic schedules. We look forward to seeing you here at Pacific College, maybe in January, maybe for future terms. Hopefully we answered all the questions that you do have. Again, thank you for your time, and you're welcome to leave. Otherwise, I will hang back with any questions that you may have.